Okay, so we will continue to talk about a human disease caused by bacteria number two. Now, this is human digestive tract. Now, you will see there's salivary glands, oral cavity, it's mouth. We mentioned about oral cavities, there's lots of the streptococcus there. Esophagus, which is a food that should supposed to be going in esophagus. And we have a liver, stomach. Now the bacteria in the stomach, it should be very low because stomach has stomach acid. It's a very low pH, 1 to 1.5. That low pH, lots of the bacteria will be died. And then you have a pancreas, large colon, large intestinal colon area, that is lots of the bacteria supposed to be there. And then small intestinal and bowel bladder and the appendix. Now in this intestinal area, there's a huge amount of the bacteria. So the gut microorganisms, there are some of the new research saying they are playing an important role for the function of the human body. So there's lots of the research going on right now. This is normal flora of the alimentary tract. So we just mentioned that. The stomach, not many bacteria there, maybe 100 cells per ml, very few because of the acid environment. Very low pH, pH 1.0 to 1.5. Small intestinal, you will see about 10 to the 4 cells per ml, so started to increase a little bit. But when you see the large intestinal areas, there's a high concentration of microbes, can be as high as 10 to the 12 cells per gram. And most of them are anaerobic bacteria. So the ratio between anaerobic bacteria and aerobic bacteria is 1,000 to 1. And when you see the fecal sample, when the stool sample, you will see 1/3 of them are all bacterial cells. Okay, so we mentioned about, we will mention about the Clostridium difficile later on. You can see the video on tomorrow. So you can see that actually the normal bacteria in the fecal samples in the intestinal area are very important. If they lose the balance, it will cause a major problem. Now, this is something, the concept we want to mention is food poisoning bacteria in the gastrointestinal area. And I draw on the blackboard already, there's a two difference between food intoxication and the food infection. Here you see Staphylococcus aureus, Clostridium botulism, and the Bacillus cereus. Remember we did the endospore stain, use Bacillus cereus. These are, we call it a food intoxication. So what that means, which means you're eating the toxin. So even you cooking, you using high temperature cooking, it does not solve the problem because the toxin is there, it will not be died. And the characteristics for that is all these food intoxication pathogen, the time to onset of the symptoms is short, can be as low as 1 to 6 hours. Now, what are the symptoms? Basically, you will see it's nausea, vomiting, diarrhea, abdominal pain. For Clostridium, basically, if you have neurological symptoms, you will see dizziness, double vision, swallowing, and breath problems. Now, make sure the double vision, this is the characteristics, actually, difficult speaking, difficult swallowing, and this is the characteristics for Clostridium botulism. Now, Clostridium botulism, we mentioned about that already. Clostridium is a gram-positive Lord's and streak anaerobic bacteria, do not like oxygen, cannot grow with oxygen even. And it's an endospore forming bacteria. And we mentioned about there's 3 botulism. Number 1 is food botulism. You will see all these canned food. These canned food we also call it low acid food because its pH below 4.6 and water activity around 0.85. This environment will killing lots of the vegetative bacteria, lots of normal bacteria, but endospore bacteria like Clostridium will dominate. So what they do, all the time they're using a cold pack, which means these jars, you just put in a cold water for like 2 hours. Of course, you boiled it first for 2 hours, then put in the cold water like 8 hours. It's not going to solve the problem. The endospore will be there. So right now, what they do is they use high pressure cooker, which means PSI has to be 15. Temperature needs to be more than 121 degrees Celsius. And also sometimes when you see the label of this canned food, you will see they have a citric acid there. They add a citric acid or they add a citric concentrate. They will try to lower down the pH below 4.6. Now, by the way, for the canned food in West Virginia, we do have a regulation, but the only standard what we have so far is a pH. We require the canned food, the pH is lower, below 4.0. So this is food botulism. Now, second one I mentioned is that the infant botulism. Infant botulism, always remember one sentence, never feeding less than 1 year old newborn baby honey. Otherwise, you will have a floppy baby. The problem was because it's a muscle relaxing. Okay, this is in contrast with Clostridium tetani. Clostridium tetani is muscle contraction, no relaxing. The last one is cuts, which is wound botulism. That is coming from the cuts. If you have a decayed metal and then you do not and then you do not really do the sanitize and cut some places, it's gonna start to growing and invasive. That is called wound botulism. Now this is Clostridium tetanus. Clostridium tetanus is in a different from the Clostridium difficile, Clostridium botulinum. The key sentence here is actually is a lockjaw. So what happened after it's penetrated into your bloodstream and neurological systems, it will be block the neurotransmitter to control the muscle of relaxing. So the muscle will be completely contracted. So we call it a lockjaw. That is what happened in the picture. But you also should know that the Clostridium should not be a problem in the United States for tetanus because we had a vaccine. The vaccine called the DTaP, diphtheria, pertussis, what is T means is tetanus. So if you did have the vaccine, that should be solved the problem because vaccine is the most important way to prevent these bacterial infectious disease. So if you have a tetanus, really have without vaccine, not much we can do. You would have infection, muscle stiffness. The only thing what we can do is a combination of antitoxin and antibiotics. This is a slide which showed you why botulism will cause floppy baby and tetanus will have lockjaw. So what happened is the central nervous system, you will have some of we call its neurotransmitter. So acetylchlorine, which is signal for the muscle contracts, and the glycine, which is signal for the muscle relax. Now, botulism, you block the release of acetylchlorine, so there is no contract. It's always relaxing. Therefore, you have a floppy baby. And for the lockjaw, you see the tetanus, it blocks glycine. Glycine responsible for muscle relaxing. So you block relaxing signal. So there's no way you do the relaxing. The muscle is always tough. That's why you have a lockjaw and you have like a stiffness. Okay, so this picture shows you the different opposite mechanism of botulism and tetanus toxin. The third one is Clostridium perfringens. Clostridium perfringens, very important characteristics is mild necrosis. We call it gas gangrene. This is what's going to happen. So the gas gangrene, why it will happen, this is have the toxin. The toxin will damage the enzymes, and then the enzymes will be degraded, the connection between the muscle. So once the muscle has been break down, you got lots of the gas and air between that. So you push the muscle and further push the blood vessel, so there's not enough blood pressure. Not enough blood pressure, which means not enough blood going to the tissue and the organ like liver and the spleen. So what happened is those organs and tissues will start to degradation, decay, will cause a coma, shock, and obviously there's hypertension for that, and a low blood pressure. So this is for gas gangrene. And I mentioned the gas gangrene, the important way to control it. It happens on the food products all the time, is to avoid the dangerous storage zone of the food, which is 40 to 140 degrees Fahrenheit. And the characteristics to diagnose this one for Clostridium perfringens is they have a double beta hemolytic zone on blood agar. And I draw the picture on the blackboard. Now, this is something else, which is a pseudomembrane colitis. This is caused by Clostridium difficile. We call it cadif. This is nosocomial antibiotic-related colitis. So what happened is any patients, usually the older people in the hospital, they continuously using antibiotics for about 7 to 14 days. Then all the normal bacteria has been died. Then what happened is Clostridium difficile will be dominant. And then this is also an AB toxin. So we have a toxin domain and the transmembrane domain. Now what happened? You will have these pseudomembrane in the colon area. And you see these pus. This is actually dead blood cells. So you have a bleeding comes out also. Now this is what happened is usually happened in the hospital a lot. Okay. Now, what are we going to do? Why will be causing? Because we use antibiotics too much, continues to do that. Using amoxicillin, ampicillin, clindamycin, cephalosporin, way too much. Now, what's the best way to control it, to do the treatment? There is a 3 ways to do. Number 1 is very ironic. You should choose another antibiotics. So for example, you use amoxicillin too much, ampicillin too much, you use vancomycin. But it's very ironic because you already caused by the problem intensively use antibiotics. Then you use another antibiotics. Signs of very ironic. The second way is that we do, if it's a mild symptom, you may drink some of the yogurts or some of the lactic acid products. Because when you're drinking those dairy products, which help to put the normal bacteria back to the intestinal area. Number 3, if it's very severe symptoms, emergency, what we have to do is a fecal transplant. This is something seems horrible, which means we're going to transplant a fecal stool sample containing with huge amount of normal bacteria back to the patient. The idea is also to put normal bacteria back to inhibit the Clostridium difficile to grow. So this is Clostridium difficile. Now I also want to mention the Clostridium difficile usually happen in the hospital, same as methicillin-resistant Staphylococcus aureus, which is nosocomial infection. But recently, because it's widely happening in the hospital, so they go to environments, go to drinking water, go to food processing line, what happened is it's become a problem of the food safety. So it's a new emerging pathogen in the food safety area. There's lots of the research done that. Okay, this slides here, we actually is talk about foodborne and waterborne infection of the gastrointestinal tract. What that means, which means these are food infection. It's not a food intoxication. The idea is for all the foodborne pathogen and the food infection microorganisms, you do thoroughful cooking, you solve the problem. So we're going to mention something here. So Salmonella typhimurium, this is the first one. Salmonella typhimurium causes salmonellosis, most likely eggs, poultry animals, and it is a major pathogen for the poultry meat. And USDA have a requirement, so raw poultry carcass has to be below 7.5% positive rate for Salmonella. Now, second one, I want to also mention here, emphasize here, Salmonella typhimurium, usually we call it non-typhi Salmonella. Because when we talk about Salmonella typhi, that's another whole story. It will cause typhoid fever, contaminate the food and the water. Now, Salmonella typhi, there is a story behind that. The lady called Mary Hogan, which is caused a major mystery in the infectious disease history. She's a resident in the New York State, in the New York City. So she contaminated or congested with Salmonella typhi. She had a mild symptoms fever and never have any problem. Okay, never have any problem. Then he become a cooker first into the restaurant. All the people surrounding her died after a couple of weeks of the contamination, cross-contamination. Then she got fired, then find another job, is become a booker in a bank. Then the people surrounded her also either got disease or died. So later on, the NYPD, New York City Police Department, has to be got her got into custody and quarantine for about 6 years. Now after that, when he went out to find another job, she contaminated with person again. Then she was put in custody again. It's kind of like a prison for like rest of the life. And she died around 1942 because of the complex symptoms of the fever and with some of the liver disease. Now, it's always a mystery why this person, Mary, never herself, never have a problem, but other person got contaminated. Until 2013, the Stanford University did the research, find that there is a Salmonella typhi, which is protected by a macrophage in the spleen sample of herself. So Salmonella typhi, we also call it typhi Mary. We give another nickname called typhi Mary because related to that story. So that's why I want to mention, when we talk about all the Salmonella, like Salmonella Newport, Thompson, typhi murine, which is actually, we call it Salmonella non-typhi. Okay, so Salmonella typhi is another completely story. That story related to typhi Mary. Now, vibrochloria, we will have another slide to talk about. It's going to cause chloria, most likely for the seafoods. Now, Shigella, the same as E. coli. Shigella will cause Shigella toxin. Shigella toxin have AB toxin. Basically, it will be cause water diarrhea with kidney disease. Capillobacter jejuni. This is another bacteria, which is microallophilic bacteria, will be grow with limited amount of oxygen, with 10% carbon dioxide, and the other components of nitrogen. This is another major pathogen in the food, in the poultry meats, which is required the positive rate less than 10.4 in raw carcasses based on the USDA. Okay, E. coli, we can talk about a lot. There's different type of the E. coli. Let's say pathogenic E. coli, normal E. coli, and enteroinvasive E. coli, enteropathogenic E. coli, intoxication E. coli, and the E. coli 0157H7 will cause hemorrhagic uremic syndrome. So all these things we will talk detail later on. Now, Yersinia. Yersinia most time is in the milk, raw milk typically, but also it will be in the pork chitlings. And you guys never eat pork chitlings, the pork intestinal. But in the Asian countries, like in China, Vietnam, lots of the times we eat pork chitlings, the pig chitlings. So if you don't do a good sanitizing, you have problem of Yersinia. Now, Listeria monocytogenes, that is another one, which is caused ready-to-eat meat, like hot dogs, and turkey breast, and also will contain milk and cheese, will cause listeriosis. It's a very complicated disease, including possibly cause miscarriage of the pregnant woman. Now, Listeria monocytogenes is also difficult to control because this is a pathogen, we call it cyclotrophs. If you still remember the definition of cyclotrophs, this is a pathogen can grow very well in the refrigerator temperature. It's different to E. coli and Salmonella. Salmonella and E. coli is mesophiles. They're not going to grow at all in the refrigerator temperature. But the Listeria monocytogenes can grow in refrigerator temperature like 4 degrees Celsius very well. That's why it's ready-to-eat meat. If you put in the refrigerator temperature, even you vacuum package, you still not solve the problem. So we will mention this later on. The next one is the vibrio parahemolytic. Of course, it's going to cause paralysis. Later on, actually, is causing the hemolysis of the blood cell. Most of them, vibrio, happened in the seafoods, typically shellfish. Now, Clostridium perfringens, Clostridium difficile, we already mentioned about that. This is something talk about oral cavity, which is related to the dental health. Now, some of you will go to the dental school after graduate, so we talk about a little bit here. So first of all, there is 2 reasons will cause dental problem. Number 1 is genetics. You cannot control it. Number 2 is the diet habits. So this is what happened. If some of you like to eat rice, like to eat bread, all those high sugar products, including chocolates, you're going to have lots of sugar there, like say sucrose, glucose. Now those ones will be actually stick on the teeth surface. Once they stick on the teeth surface, you know the oral cavity, there is a lots of the streptococcus there. We call it Viridium streptococcus. A good example is Streptococcus mutans, and they will be there. If you do not do a very good personal daily dental hygiene, let's say teeth brushes, if you don't do it very well, Streptococcus mutans will grow there dramatically, even to form biofilm. Now what happened in your teeth, in the oral cavity, that is actually a very lower percentage of oxygen, close to the anaerobic environments. Now what happened is these sugar will go through fermentation process, generate lactic acid. Lactic acid is a huge amount of the acid. The acid will cause the demineralization of the enamel, then leading to the tooth decay. So basically what happened, if you are eating too much sugar or the sugar in the food products, they're going to stick on the teeth surface. If you do not do the teeth brushes too good, Streptococcus mutans will be growing there. Then in this anaerobic environments, they will go through fermentation, generate lactic acid. Then what happened later on is demineralization, enamel, and cause tooth decay. So that's one of the reasons will cause plaque formation on teeth. Now this is chloreal. Chloreal, we mentioned about that. Vibrio chloreal, it's a common shape, gram-negative bacteria. Most of the time happens in the seafoods, in the marine ocean area. And the shellfish is a natural reservoir for that. They will cause a toxin. The toxin is a Chlorine, will dramatically to lose water in your body. So if anybody who is got chloreal toxin, they're gonna lose probably 10 liters of the water in like 1 hour, and will have rice water stool samples. What happened is later on, person is died because of dehydration. So what they have to do, if you have a chloreal toxin, you have used antibiotics, anti-intoxication. But the first thing what you need to do is rehydration. You need to put water back in your body because too much water is loose. Why? There is a story right here. Okay, you have a sodium, which is to maintaining the balance, we call the osmotic balance of the intestinal area. If vibrio chloreal there, they will have acetocyclase. enterotoxin from the vibrio cause acidocyclis. I mentioned about that one time. Acidocyclis will later AMP become CAMP, which means cyclic AMP. Remember, AMP is supposed to become ADP, then become ATP. If they are activated by adenine cyclase, which means AMP cyclic, become CAMP, what is going to happen? You can't use money, you can't use energy currency. Then it will be blocks uptake of the sodium ions. Then what happened? It causes increased sodium chloride, which is in the lumen and draws in the water, because the osmotic balance is broken. So all of the water from the blood vessel, from your body, go into intestinal, become rice water stools. And you can lose water dramatically, about 10 liters in 1 hour. Okay, so that's a major problem, this toxin. Okay, so that's a vibrochloral. Okay, we end up here is a second section, and I also have some video there. You can go ahead to watch. I'll put on the YouTube channel, hopefully tomorrow, Thursday. Now, we're going to have one more section, talk about bacterial disease. Then I'm going to put some of the after-class reading material on eCampus. So hopefully you're going to go ahead to read that, because those are going to be very helpful for the open book examination of the examination too. Okay, so thank you.